Good evening. I'm your host, Ann Jagger. Tonight we're devoting a full 30 minutes to your health care, and our focus tonight is on a new way of treating one of the most talked about diseases, one that impacts almost everybody, either personally or a loved one, and that is cancer. In the near future, your cancer care will get very personal, and that is good. Personalized medicine takes a completely new approach to cancer. Tonight, we'll find out what's happening right here in Oregon, talk to those leading the way in this new approach to treatment, and hear from those patients whose lives have been saved by a once-a-day pill. You know, cancer definitely changed my life. 11 years ago, I was diagnosed with a somewhat rare form of cancer. I was a single mom, I was working full-time, and in my 40s. I had many choices to make, and very quickly. And like millions of other cancer patients, when you hear that diagnosis for the very first time, you do go to the worst place possible. Just like Kirsten did, one of the inspiring people you're going to meet tonight. But unlike Kirsten, I didn't have that one very important weapon in the fight against cancer. And that was this personalized approach where each cancer is diagnosed and treated differently. Personalized cancer medicine means many different things, but at the heart of this approach is targeted therapy that zeroes in on the cells that are making an individual's tumor grow, but without harming any healthy tissue. What many of us fear about cancer are the side effects of treatment. Targeted therapies, because of how they work, aren't as harsh on our bodies. Right now, the number of targeted therapies is limited, but that's changing too. Scientists at OHSU's Knight Cancer Institute are working hard on research that will lead to development of more of these therapies. In the future, we won't be talking as much about common cancer groups like lung, prostate, and breast cancers. Instead, the treatment will be about finding out what's going wrong in your body and is making your particular cancer grow. This revolution, which is transforming cancer research and cancer care, was pioneered here in Portland at the Oregon Health and Science University's Knight Cancer Institute. Let's start from the beginning, how this new revolution that's unfolding in cancer treatment came about. There are so many images associated with cancer. Here's one you might be familiar with. It's the glow of lanterns against the night sky as volunteers, many of them cancer survivors and their families, walk to raise funds for the Leukemia and Lymphoma Society. What many of you may not know is that personalized cancer medicine is possible today because of Dr. Brian Druker's groundbreaking research that led to the development of the leukemia drug Gleevec. Leukemia patients in the Portland area, some of whom were in hospice more than a decade ago, are alive today because they were part of the clinical trials for Gleevec. Today, these patients are leading normal lives.
My husband plucked me out of hospice in Washington and took me to OHSU and begged them to give me the medicine. The life went out of me slowly, in a matter of 2 months, I think, till there was no more life. But it jumped back into me in a swoosh.
I was number 9. I've been on Gleevec now longer than anybody in the world, continuously on anybody. And that's kind of fun. Yeah, it sounds really strange to say it's fun to have leukemia or to have this cancer, but it was really at the right time and place. I had been diagnosed in '95, and that's when they said 3 to 5 years is life expectancy. When they say it's 10 years since the approval, for me it's almost 12 and a half years since I started Gleevec. So it's you know, it's like an anniversary of my being alive. Someday you won't wake up and go to sleep thinking about your cancer.
Judy and LaDonna were both on hand at the 10th anniversary of Gleevec, an opportunity neither thought possible without this discovery. Gleevec's success has since multiplied. Given this drug targets what makes the cancer grow, it helped patients with other types of cancer that are driven by the same abnormality. What Dr. Druker learned from Gleevec is that it's possible to stop the process that enables cancer to grow. What matters most is finding the biological switch to turn it off. There are many different types of breast cancers, prostate cancers, and lung cancers, just to name a few. As every person is unique, so is their cancer. While it is important where these cancers show up, knowing which cells are going haywire and driving them to grow is the most important thing. Tonight, we'll meet Dr. Druker, the doctor who's leading this revolution, the members of his team who are putting this approach into action, along with the patients who have benefited from personalized care. We'll learn why the OHSU Knight Cancer Institute remains on the forefront of personalized cancer medicine because of the work done here by Dr. Druker and the other experts. We'll also learn how personalized cancer medicine is evolving. It's not just about new types of cancer drugs, it's about how each individual's cancer is diagnosed and the capability of the tests done at OHSU Knight Cancer Institute. We'll learn how treatment programs are put together by a complete team, how specialized nurse coordinators help guide patients through the treatment process and into survivorship, and how multidisciplinary clinics at the OHSU Knight Cancer Institute make it possible for patients on one visit to see the whole team of doctors working to help them. Those doctors will meet with each other on the same day to share observations and ensure that the treatment program is the best it can be. At the end of the day, the goal is to make it possible to change the way we all think about this disease.
There's a tremendous amount of work going on in that avenue, and the Knight Cancer Institute, OHSU, is poised to take advantage of that as well or better as any other institution in the country, because we have the appropriate, we have the dedicated laboratory. We have researchers in the laboratory. We have physicians who are all involved in some form of personalized therapy. And that's really our mandate, to see to it that that's how we treat cancer patients with improved manner, fewer side effects, and of course more effective therapy.
How does this personalized cancer medicine work, and what does this approach mean for patients? For patient Carolyn Hayhurst, personalized medicine resulted in a dramatically different end result than she expected when she learned she had brain cancer. Carolyn's first journey with cancer started years ago. She knew something was wrong when she couldn't shake her cough.
I had a little bit of a cough. I got x-rays, they took a CT, and that's how the tumor was found. I was diagnosed late in the year in 2006. And lung cancer is one of those sneaky kind of cancers that you don't really know you have it until you've got some kind of symptoms that brings you to the doctor, and then by then it's pretty serious.
Years later, Carolyn became so weak she could barely climb the stairs. Then she developed a headache that sent her to the emergency room at a hospital in the Oregon beach town where she and her husband lived. It was there that Carolyn learned she'd face cancer a second time, but this time it was in her brain. Carolyn was referred to Dr. Alan Sandler, a nationally recognized cancer expert. His theory was that the same changes in the cells that caused her lung cancer to grow were causing the tumor in her brain. The therapy that Dr. Sandler recommended is designed to shut that down.
Well, we're going to take that tumor and we're going to send it out and we're going to do testing on it. And that way we can figure out what kind of cancer therapies are going to work best just for you.
Dr. Sandler's next step was to run a test capable of identifying the exact mutations driving her cancer to grow and spread.
The unique aspect of the new generation of targeted therapy is we're not just going after the gross tissue or the tumor itself, but we're actually going at targets within the cancer cell itself, not even the tissue, but specific to the cell. So a particular target, a genetic defect, if you will, in the DNA that can be directed and attacked. And the benefits are the following. So number one, since it's unique to the cancer, the normal cells in the body don't have it, so they shouldn't be affected, so there's less side effects. And if it's a process by which the cancer is very dependent upon for growth, and you're able to block it, the cancer should die, or at least sort of go to sleep and stop growing.
It all goes back to the lab, and research being done here is helping patients like Carolyn Hayhurst, sparing her from harsh treatments that may not have done her any good.
We used to use, up until very recently, what we would consider 17th century technology. That'd be the microscope. It's been around for hundreds of years, and basically you would just look at the tumor and determine that it was, say, a lung cancer, and what we call the histology, and then treat with chemotherapy, which is a modestly effective, although potentially toxic treatment that was essentially the same regardless. Now what we're doing is we are looking for specific genetic defects. If there's a mutation present, which occurs in upwards of 30 to 40% of non-smokers, an individual can get treated with a pill called erlotinib, goes by the trade name Tarceva, instead of chemotherapy. They don't lose their hair, doesn't affect the bone marrow, they may have a mild rash.
I've been able to live basically a symptom-free life and do everything that I want to do because of this.
And her focus can go back to the ones she loves. It was that kind of personalized cancer care that makes the OHSU Knight Cancer Institute stand out, not only in the Northwest, but in the world. The right diagnosis starts here in the lab. Dr. Chris Corliss is medical director of the Knight Diagnostic Labs. He's on the forefront of using the most sophisticated testing available today, and it can make all the difference to a cancer patient. Dr. Corliss was also involved, along with Dr. Sandler, in the test that led to Carolyn's treatment.
We had an opportunity to examine the DNA from that brain metastasis and found a mutation in that DNA that told us this tumor should be sensitive to the particular drug that the patient then received. And that's why I think she had a very good response. We tailored her treatment to the mutation that we found in her tumor.
The promise of these tests is just now beginning to unfold. OHSU's Knight Cancer Institute envisions that each patient who suspects they have cancer or has a tumor would receive one of these sophisticated tests.
So the testing is of absolute paramount importance, and we're fortunate enough here to have what's known as the Knight Diagnostics Lab, using equipment that's available very few places in the United States. The Sequenome system that Dr. Corliss is using is one that is able to look at many, many genes and hundreds of mutations. OHSU and the Knight Cancer Institute is clearly poised to take full advantage of this.
The test is part of OHSU Knight Cancer Institute's philosophy that personalized cancer care must start with a detailed knowledge of each patient and their specific tumor.
We all have DNA, that's our basic genetic structure. And yet, each of us is different, and that's because we have subtle differences in our DNA. Well, it stands to reason that if you get cancer, that your cancer is going to be a little bit different from the next person's cancer. And so by studying cancers at the DNA level, we can begin to dissect out the special differences that will then allow us to tailor therapies based on those differences.
With the knowledge that Dr. Corliss provided, Carolyn was treated by Dr. Sandler with a less invasive drug.
I think we've only scratched the surface, but to see individuals who were clearly suffering and deteriorating in their care and not able to do their day-to-day activities at all, and then to see them walk into after prescribing, in a particular case, maybe targeted therapy, and then to see them walk into the clinic looking as they did months ago and feeling as well as they did before they had cancer is a wonderful, wonderful experience.
Welcome back to this very important program about cancer. Now, what every patient wants to know is, what's available today? How can I be sure I'm getting everything available to give me the best chance of a healthy life, and that cancer treatment won't interrupt my life too much? The best possible scenario is a treatment program that takes into account not only the personal nature of your disease, but also your life. Cancer can touch everyone, whether you're young or old, rich or poor, retired or at the peak of your career. It doesn't discriminate, so a one-size-fits-all treatment approach doesn't work either. Recognizing the stress that treatment was putting on patients, their families, and their lives, the OHSU Knight Cancer Institute resolved to change the treatment experience. Rather than asking patients to navigate through each appointment and specialist separately, the experts here completely overhauled the process to create multidisciplinary clinics. A clinic that brings together all of the key players in your path to treating the disease. This process starts with the diagnosis and increasingly the diagnostic test. But just as important, it also begins with a human touch, a nurse navigator or coordinator.
Our goal here at the Knight Cancer Institute is to offer patients complete care. And what that means is multiple disciplines, different types of doctors that are involved in the care are all together in one hallway is how we do it here, and the patient is able to come to the clinic and see the surgeon and the radiation oncology doctor and the oncologist and get input from all of those doctors at one time.
Kirsten Williams is a nurse by profession. She's worked in the intensive care unit, trauma, and the emergency room, but nothing prepared her for a breast cancer diagnosis.
I got the phone call out at my daughter's home saying, got your results and you've got breast cancer.
Her diagnosis led her to the OHSU Knight Cancer Institute and Dr. Stephen Chewy.
Loved him immediately. And that's the other thing that I really appreciate is people being really honest with me.
And from there, she met her medical team who would help her chart a course to treat her disease. In Kirsten's case, that also meant being part of one of the most sophisticated clinical trials.
Ms. Williams came to us to OHSU with an early, potentially curable breast cancer. We presented her with the option of being treated on the I-SPY trial, looking for an individualized approach to treating her tumor. We talked with her about either standard of care therapy, which would involve surgery up front. She elected to actually go on the I-SPY trial, which provides her chemotherapy up front, which doesn't provide any sort of detriment, and offered us the opportunity to really test and see whether the therapies that we were offering to her really did work to shrink down her tumors. In that way, Ms. Williams, I think, has a certain advantage. She knows whether her chemotherapy works or not. Unlike how we've traditionally done things, which is taking out a tumor and then treating what we can't see. We actually got to watch her tumor shrink, and we can really give her with a good sense, with a great deal of confidence, yes, your treatment did work because your tumor did shrink.
Kirsten Williams' training as a nurse kicked in when she had to look at her own treatment options. For her, OHSU Knight Cancer Institute was a perfect fit.
So breast cancer therapy really does require the input of multiple different physicians. Surgeons, radiation oncologists, medical oncologists, input from other subspecialists, radiologists who do the breast imaging, pathologists who really tell us what's going on and ultimately tell us what is it that we are treating. At the Knight Cancer Institute, we have a multidisciplinary breast clinic where all of these physicians work together both on an intellectual level. We are physically located together so that we can have the type of discussions face-to-face that really I would argue that only a face-to-face discussion can have efficiently, if you will, to try and decide what's the best way to treat a woman who's been recently diagnosed with breast cancer. What kind of treatment plan would serve her the best, and how can we get her her best outcomes?
And what comes up for each person is different. That's where the support team comes into play, treating not only the clinical side of Kirsten's cancer, but the emotional side as well. Susan Headland has been on the receiving end of many of those conversations.
Well, as you might imagine, it's often a range of emotions. I think in the beginning there's a lot of fear and disbelief, and I think fear about, can I get through treatment? How will this change my life? How will this affect my loved ones? And generally speaking, I think there's a lot of grieving involved around the losses, even though they may be temporary, that they're experiencing with a cancer diagnosis. Fortunately, as time goes on, most people can and do find ways to adapt to the change that they're going through, and we like to think that we help them gather support around them to help the experience be a little easier.
So when will the promise of personalized cancer medicine become a reality for all patients? When will every cancer patient have the option to take a drug like Gleevec? Many across the country and the world look to OHSU Knight Cancer Institute as the leader in personalized medicine, to Dr. Brian Drucker, who is the Institute's director.
In the last 10 years, targeted therapy has been, in my mind, the biggest breakthrough. We're finally understanding what drives the growth of cancer. We're targeting at its roots, and we're beginning to see responses in patients that we as cancer doctors never thought was possible. Tumors that we thought were unresponsive to our standard treatments melting away in front of our eyes. Now, we still have many challenges in terms of resistance and understanding what causes resistance, but we have the tools now to understand cancer and defeat cancer in a way we never had before, much in part thanks to targeted therapies.
A little yellow pill made the world stand up and take notice.
Well, really, for the first time, we actually treated a cancer based on what was driving the growth of this one particular type of leukemia with a drug that shut it down. And it worked remarkably well. In our early clinical trials, we had a 98% response rate and with good durability. We took a cancer that had a 3 to 5 year life expectancy that now has a 5-year life expectancy of 95%. And it's just completely revolutionized the way we think about cancer, the way we treat cancer.
Dr. Druker has a simple analogy to explain targeted therapy.
If you think about the cars we drive, a Ford, a Chevy, a GM, we kind of define ourselves by the type of car we drive. When you go to the mechanic doesn't define your car by you have a Ford, a Chevy, or a GM. They lift up the hood and see what part's broken and fix the broken part. That's what we're doing with cancer now. We're looking inside the cell and we're saying this breast cancer actually is driven by this specific abnormality. And guess what? That same part broken colon cancer and lung cancer and melanoma, so we're treating based on the broken part, not by the site of origin. And that's been the major revolution in the way we think about cancer and ultimately the way we'll treat cancer.
And it came from seeing his patients go through some very tough times with conventional treatments.
I started out taking care of cancer patients, and I promised to them I would find a better way. Instead of giving them chemotherapy that leaves our patients pretty bruised and battered, I wanted to do something different and to make an impact on this disease. But I've seen with my own eyes what we can do when we understand cancer and can target it specifically. So when you think about treating cancer in the past, we've treated cancer pretty empirically. We've said you have lung cancer, breast cancer, prostate cancer, and we've devised a treatment that oftentimes doesn't work but is just based on trial and error. Now what we're saying is we know what's broken, we know what's driving the cancer, and we can target it with a specific therapy that works the first time, is far more effective, and actually may have fewer side effects. And that's a complete change in the way we approach cancer.
While he is optimistic, there are some definite challenges along the way to achieving his vision for ending cancer as we know it.
We're in this together to fight cancer because we want to defeat it and end it. When we think about cancer research, it does cost a huge amount for us to run our laboratories, for the research that we do. And the infrastructure that we can set up to understand each individual's cancer, to bring new drugs out of the lab into the clinic, that requires significant effort and significant funding. Some of that comes from federal funding, some of that comes from private philanthropy. But it's working together that's going to let us solve this problem most effectively and most rapidly. Our funding rates are at about 10%, and that's responsible for 2/3 of funding for cancer research. That means that 1 in 10 of our ideas are funded, 9 in 10 aren't. Well, our view is that we started this revolution. You look at a drug like Gleevec, that came out of the research done at the OHSU Knight Cancer Institute. We think we understand this better than any other center in this country. We already have a diagnostic lab that's doing molecular diagnosis of cancer at a greater depth than most other centers around the country. My point is we understand this area better than most other places in the world, and we think we can continue to make an impact and have a leadership role.
And he has a lofty goal for the physicians, researchers, nurse navigators, social workers, everyone that comes into contact with a patient.
Our goal is to end cancer as we know it. What we mean by that is by taking the knowledge that we've developed into targeting cancer at its base, at its roots, and applying that to every single patient and every single cancer. When we talk about molecularly targeted therapy, treatments like Gleevec, we want to make that a reality for every single patient that walks through our doors and to export that throughout the rest of the country and the rest of the world. And by doing that, we think we can defeat cancer.
Tonight, you've met some of the doctors, nurses, and members of the team on the forefront of this revolution. You have many questions about your health care, and we'd like to hear from you. As Dr. Drucker said, the OHSU Knight Cancer Institute is dedicated to providing individually tailored, compassionate care to patients and helping find new targeted therapies to treat cancer. Their hard work is paying off, and it's truly changing the face of cancer, and the goal is in sight, to end cancer as we know it. Good night.